Hi, Candace.
Hi, good morning, Dr. Tanner. Good morning, Victoria. How are you both this morning?
Great. How are you doing?
Doing great, thank you. What can parents do to maintain a clean and germ-free nursery?
All right, well, I have 3 tips that hopefully will help out quite a bit to that end. So the first tip is you want to know where the germs are in the nursery. Most of the germs in the nursery are going to come originally from a dirty diaper. I hate to say that, but it's true. So cascading down from that, you'll see that there's a hot spot for germs on the changing table. And then what we call high-touch surfaces, or surfaces people just have their hands on a lot, like toys and doorknobs, etc. So you want to first identify where the germs are. And then after that, there's 2 more tips. The first is about preventing the spread of germs in the nursery. And what you want to do for that is you want to have a mess-free diaper changing routine. So you want to have, for example, antibacterial hand wipes nearby, everything you need at your fingertips. And then you want a good place to dispose of the diapers. So if you have a Diaper Genie Elite, it has a foot pedal that allows you to dispose of a diaper without having to fumble with a lid or set the diaper down and potentially spread germs in that manner. And then the last bit of the puzzle is to do regular disinfection. And for that, I like for anyone who's maintaining a nursery to know to use an EPA-registered disinfectant. And then there's a tip I can give there, which is to do a water wipe down after the disinfection process. And then you get all the benefit of the chemical disinfectant without any of the negativity associated with chemical residual.
And Dr. Tanner, you recently conducted a nursery germ swab test in Victoria's home. Can you tell us a little bit about that?
Sure. So Victoria was brave and kind enough to let a microbiologist into her nursery. And what we did there was we swabbed with sterile swabs a variety of surfaces like the side of the crib, the inside of the crib, a toy, a changing table. And we looked for 2 different categories of germs. The first is just background germs, which aren't harmful. And then the second is germs that can indicate the presence of bad germs. And we found very low levels in general in her nursery. So she has a very hygienic nursery and is doing some things right. And not surprisingly, we found some intestinal type germs on the high touch surface of a toy and then also the changing table.
And what can moms do on a daily basis in order to minimize germs?
Daily basis is just have a nice, well-prepared setup diaper change routine first, and then disinfect those high-touch surfaces after you certainly have a messy change, and then wash your hands regularly as well.
And how about when it comes to cleansers? How do moms know which ones are safe to use around their baby?
Well, there's 2 things going on there. So you have the safety of a cleaner, and then you have what we call its efficacy, or its ability to kill germs. To find out if it can kill germs, you want to look for signal words on the label like disinfects, sanitizes, kills germs, and that tells you it's an EPA-registered disinfectant. And that'll help keep germs under control. In terms of safety, with disinfectants, you have the benefit of they have signal words on the back, and they'll either have no safety warning, or they'll say caution, warning, or danger. And you want to stick with something that's either caution or no signal word on the label when you're using it in a sensitive environment like a nursery.
And Victoria, as a busy mom of 4, can you tell us a little bit about your cleaning routine?
I pretty much have been doing the same routine since I only had 1 child. I've just kept it going and tried to make it a little bit more efficient with the time that we have now. So I've been, washing my hands after doing the diaper changes. I've been wiping down the changing table mattress, and also making sure that things are in the right place in the room so that, the toys are in the toy bin and the diapers are in the diaper caddy so that things aren't on the floor. And then now, because of the results from Dr. Tanner's swab test of the nursery, I've also made sure to clean the hard toys that my son has a little more frequently to make sure that, those are always great for him to have.
And what advice do you have for busy moms such as yourself?
I find that germs are everywhere, so don't be too frightened about it, and think that you have to clean nonstop in order to have a good home for your family. Parent with common sense like most of us do, and you'll find that what you're doing in your routine is perfectly fine and things are going to be okay for your children.
And this question is for both of you. Do you have any additional tips or information you'd like to share?
Sure. So you can find, I shared a few tips with your viewers, but you can find some more tips at playtextbaby.com on how to keep a clean and germ-free nursery. And then I think probably savvymommy.com has some tips on there.
Well, thank you, Dr. Tanner. Thank you, Victoria.
Thanks, Candace.
Thank you.
Thank you.
Bye-bye.